I see the pickleball world just exploding right now. Yeah. And because it's exploding, I'm seeing a lot of patients in my clinic. So I love seeing you guys, but I want you guys to not have any injuries, which is why you guys are here, right? Yeah. All right. So with that being said, I mean the title of this talk is talking about preventing foot and ankle injuries while playing pickleball and similar sports. Okay. So just to kind of an overview of what we're going to talk about today, we're going to go over some injuries that you may experience while playing pickleball or any similar sports. We're going to talk about some prevention things you could do, treatments, some shoe gear related topics, embracing, taping. When can you treat it yourself and when can you come and see me? Okay. All right. So a little bit about myself. Okay, I am a Southern California native, born and raised. I am a double board certified foot and ankle surgeon. I work here at Garey Orthopedics. We're here on site at Casa, Colina. I've been here for 5 years, and Garey Orthopedics has been here forever. Okay? Um, I love and enjoy being active. I love traveling with my wife and my 1.5-year-old son. We just went to Italy when he was when he was a 1 year old, and I always tell people it was very memorable but very tough. Okay, so as we kind of alluded to, the growing popularity of pickleball is just it's insane how much it's growing, and that's a lot of the reason why you guys are here. There's a lot of benefits to the sport. I mean, it's bringing you guys all together to play with friends, and there's a social aspect to it. It's helping work on your general health. I mean, cardiovascularly, you're gonna have to get up and move, and that's fun. Um, and it works on balance and coordination. As we mature, that's very important to be able to maintain strength and balance, and playing these types of sports helps to encourage that type of improvement. And so, yeah, increased popularity means more people in my clinic, and we want to try to reduce that as much as we can, okay? So a very famous person said this: your foundation for your body and success on the court starts with healthy feet and ankles, protecting them, protect them, and they will carry you further through the game. Okay, very famous person. Okay, and my goal is to try to bring you back on your feet and enjoy your hobbies pain free. I mean, look at she looks really happy. She looks like she doesn't have much pain. All right, so let's dive in. We're going to talk about some injuries, foot and ankle related. Okay. So before we talk about the specific injuries, we're going to talk about some risk factors, okay? So just inherently by playing any sport, and in this case pickleball, you're exposing yourself to potentially becoming injured, right? You're active, you're doing movements that could potentially put stress or strain on your body, and this can lead to injury. So specifically when it comes to playing pickleball, it's the quick lateral movements, okay, and then the stop and start, the moving back, coming forward, those types of movements in the sport can lead to injury. Okay. Now, some player related factors. Your age can play a role. Okay. As we mature, the tendons in our body start to stiffen. Your muscles start to become weaker, and that makes keeping up with these types of sports a little harder. Okay. So being cognizant of that is important. Having a previous foot or ankle injury. So I have patients all the time who say, "Oh, I sprained my ankle when I was in high school multiple times." It's very common. And at the time, having a sprain is probably nothing at the time. But years later is when it starts to have an impact on your body. Okay. So that alone is a risk factor. What you put on your foot makes a big difference. Okay. It can look really cool. It can have a neon color. It can have a Nike swoosh, but if it's not supportive, it's not going to help you. Okay. The playing surface, whether you're playing on grass or on a court, or if the court is older and it's a little slippery, those are things to consider as risk factors. And then fatigue and overuse. As fun as the game is, you want to play every day, but that could lead to that could lead to your body becoming fatigued and your muscles becoming weak, and that can bring on more injury. So this is kind of just an overview. Split this into ankle and foot and some specific injuries that we're going to go over. There's some overlap, and there might be some that are excluded, but I thought that these might be the main ones that we'll dive into. So let's get started. First one is Achilles tendonitis. Okay, so this is a condition that affects the Achilles tendon, which is the large cord tendon on the back of your heel. It starts as a muscle, as the calf muscle, and it courses down and inserts onto your heel bone. Just like with patellar tendonitis or like a tennis elbow, this tendon can become inflamed. And so usually the cause of this is inherent tightness of that gastroc muscle. Okay, so if your calf muscle is tight, the tendon and its insertion into the heel bone will also be tight, therefore leading to inflammation and pain and swelling. And pickleball, there are times where you have to step back and then step forward, and then that overstretches that tendon and can lead to exacerbation of those symptoms, okay, making it, getting a overstretch, overstrain, leading to micro tears. Micro tears become painful, and what we want to avoid is an Achilles rupture, okay? See it a lot. Having those types of patients who step back and they're overzealous and then all of a sudden, pop, okay? This is not to scare you, but just for you to kind of be cognizant and listen to your body. If you're ever having any pain in the back of the heel, this could be an early sign of some sort of damage to the tendon, okay? The next is ankle sprain, okay? Everyone knows what an ankle sprain is. You roll your ankle, whether it's inside or out, and this can lead to stretching of the ligaments that support the ankle. And this is, of course, important in pickleball because the side-to-side movements, and if you don't have a stable ankle, if you don't have ligaments that are stable, and if you don't have a good supportive shoe, this can lead to the rolling out of your ankle. And if you've had an injury before, you can have an injury again even more so, okay? The chances are even higher, okay? Peroneal tendonitis, okay? So the peroneal tendon starts as a muscle in the leg, just like the calf muscle, but it's on the side of your leg. And this muscle courses down and it wraps around the outside of your ankle. When those ligaments of your ankle are not stable, these muscles try to take over to give even more support. And if your ankle ligaments are not stable and these guys are firing overtime, you're going to get issues with those tendons being overstretched, potential tears, tendonitis, etc. Okay? And so this can feel like just a dull discomfort around the outside of your ankle, maybe not in the area that you typically have an ankle sprain, but just sort of the back of the ankle. Okay? Next is plantar fasciitis, WebMD's favorite diagnosis for heel pain. There are lots of causes of plantar fasciitis. Fat pad atrophy, okay, over tight Achilles tendon or plantar fascia, okay, overuse or repetitive trauma on the heel. Okay, these are just to name a few. With plantar fasciitis, if you were to ever experience it, typically patients will say that the first step in the morning, they feel tons of pain in their heel. Okay, that's one. Sometimes it's towards the end of the day after they've been on their feet all day. But pickleball will, because of the constant impact on your heel, can lead to plantar fasciitis. Okay? Next is stress fractures. Scary. With a stress fracture, usually when it comes to the foot, it's one of these metatarsals. So you can see what's circled right over here. It's one of the long bones in the foot. So not the toes, but the long bones here. You may start to feel like a dull, achy pain in the middle of your foot. Not quite sure what it is. It doesn't really go away. The more you walk on it, the more it hurts. We tend to see these in runners, military recruits, that are doing a lot of walking, and then even, pickleball with a lot of repetitive injury to the foot where you're pushing down on the ground and a lot of stomping. This can lead to a stress fracture. There's other biological reasons why someone might develop a stress fracture, Um, Unfortunately, just being a female puts you at an increased risk of developing a stress fracture. And as you age, your hormones change, and the vitamin D levels and calcium are altered, and so this can put you at an increased risk of developing a stress fracture. Metatarsalgia. This is an umbrella term for pain of the forefoot. Okay, so you might feel like a burning, dull pain on the ball of your foot. Okay, oftentimes it's sort of diagnosed as metatarsalgia. There are lots of things that cause metatarsalgia, in my opinion, capsulitis, uh, and others. But this can occur during pickleball if you don't have a good supportive shoe, or if you have the type of foot that puts more pressure on the forefoot. Okay, we're going to talk about some treatment in a second, but these are just going over some of the few pathologies that you can experience. A neuroma is sounds like a tumor, but really it's an inflammation of a nerve. Okay, so there are nerves that run in between your metatarsals. You can see right here, there are nerves that run right in between here. And if you have an unsupported foot that's going through excessive motion, those metatarsals can rub and irritate that nerve and cause inflammation. This will come in the form of burning or tingling in the toes, and sometimes numbness and extreme pain. Okay? And the last one is turf toe. Okay, so you're not playing on turf most of the time playing pickleball, but the idea is that when you have an overstretched or hyperextended big toe, this can lead to injury to the plantar structures of the big toe. This is usually accompanied by pain and swelling and just inability to move the big toe. All right, now let's go on to treatment. So for mild injuries, if you feel any aches or pains, most people know to try RICE therapy. So rest, ice, compression, elevation. Do that for a day or two. The pain goes away, great. I think you've done a good job of managing your symptoms, and then you can try getting back out there and see if you're feeling okay. In the event that you don't get relief from these types of therapies, then it might be best to come and see somebody. Okay? So persistent swelling or bruising, inability to bear weight, or not getting any resolution in your pain after a few days, despite trying these therapies, that's when it will be a good time to come and see me. All right. Now, of course, if you have a twist and you notice your foot's going the wrong way, or a bone sticking out the wrong way, you can come see me, but I'm going to tell you to go to the hospital. Okay. All right, let's go over some prevention tactics. I can't tell you how many times I explain to patients how important your shoe gear is. I'd love to think that a patient comes to see me and I give them, some treatment, and I went to many years of schooling and residency, and I've got all this training to be able to tell you what the answer is, but it kind of bothers me sometimes that most of the times the answer is your shoe. Okay, and so having a good supportive shoe, we're going to go over how to choose your shoes, as well as some things to decide whether or not the shoes you have right now are good. Okay. Um, Warming up and stretching, very important. Okay. I hear this a lot from patients who have started pickleball. It's usually, well, I used to play tennis, or I love tennis, but it's a lot of running. I got to move a lot. I like pickleball because it's a little easier on me. Okay. So I think that there's this maybe a misconception that you're not going to need to move very much, when in fact, as you guys know, there's a lot of movement, and there's a lot of intense movements that if you don't warm up or stretch properly, that's what's going to lead to your injury. Okay. Strength and balance training. Okay. So these are things you can do at home. Any types of exercises, even for your arms, your legs, around any of your joints, ankles or feet, any type of movement that you can do to try to help strengthen. So using TheraBand or weights to help strengthen the muscles around any joints of your body is always helpful. Balance exercises, so standing on a wobble board, or maybe just closing your eyes, putting your arms out, things like that. Ooh, I can't even stand. Are all helpful to help improve your game, right? technique and form. You don't necessarily have to go and seek out a coach to have the right technique. Maybe it's something that you can lean on your friends to say, hey, am I doing this the right way? But obviously having proper technique and form will reduce the amount of strain or stress on any part of your body. The important one is rest and recovery, okay? If you've played multiple days in a row and you're really having fun, but your body's kind of sore, feeling some pain, that's your body telling you, hey, I think it's time that we take a break. Okay, rest your body, because those are when the overuse injuries occur. Your muscles get strained, you have ruptures, those sorts of things. Okay. If you're tired but you want to keep active, try cross training. I mean, there are things that are not necessarily putting strain on your body, like getting in the pool, doing some pool exercises, or maybe trying an elliptical, things that you aren't really putting a lot of that high torque, high stress on your body in between your pickleball games. Generally speaking, going to a doctor, maintaining your health is important. Okay, we're talking about all these musculoskeletal type injuries and ways that you can help improve your strength. But if you have a good controlled weight and your health is under control, all of these things impact the body's response to injury. Obviously, hydration and nutrition. I'm so big on nutrition. I think that it's so important to give your body the building blocks that it needs in order to perform. I mean, any athlete in college, they're going through a whole, sports nutrition type regimen, because that type of, all the vitamins and proteins in college and all of these things, is, in my opinion, not gimmicky. I think they're all very important and play a vital role in your ability to play, to prevent injury, and to even excel and to play well. I think we kind of touched on this, but listen to your body. So if you got a Y chromosome like me, you might try to push through some pain or ignore it, but that's your body telling you something, right? That's important that you. I feel a little bit of an aching. I feel a little bit of pain. It's not getting better. I should go see somebody. Or I felt this pain after the game. I should probably not play for a few days. Or I'm feeling it really bad right now. I don't need to finish this match. I might hurt myself. Okay. Regular checkups with your doctor and getting a foot and ankle assessment. Okay, these are important things that you can do to help prevent injury. Again, from a general health standpoint, and then just getting an assessment of your foot, understanding what's my foot type. Do I have a flat foot? Do I have a high arch? Why do I feel pain here? Is it because of X, Y, and Z? Getting an assessment and making sure you have the proper shoe gear and orthotics and training regimen. Getting a foot and ankle assessment can be helpful for all of those things. All right, so let's jump in to some buying shoes tips. All right, so when you go to a shoe store, I think most people, first thing, they see how it looks. They like how it looks. They grab it, pull it off the shelf, they put it on. They kind of sit there and say, oh, that's comfy. It looks nice. Okay, it fits well. They might feel the toes. Oh, okay, the toes are at the edge. Okay, all right, I'm gonna get these. Then they go out and play, and after 10 minutes of playing, it's like, man, these things hurt. Okay, this happens a lot, and so one thing that you could do to help prevent some of these things is to make sure you try to buy shoes at the end of the day. Okay, why at the end of the day? Your foot is more swollen at the end of the day. That's just natural. It happens. Everyone has a swollen foot at the end of the day. But if you try it on while it's swollen, chances are it won't get too tight if you try it on later. Okay? Make sure you wear it with the sock that you're going to wear during that activity. So for me, I don't go and have a thick cotton sock when I go to try on dress shoes, for example. So the same thing here. If you're going to wear a certain type of sock while you play, you want to make sure that you're using that sock while you're trying it on. Okay. It's not uncommon to have one foot that's slightly bigger than the other. I know it seems like things should be very symmetrical, but it's not always the case. And so my recommendation is to get the shoe that fits the larger foot. Okay. Because most of the times, unless you have some significant deformity that makes it completely different, you're really only talking about a small difference. Okay. Um, Measure your feet every time you go and get a shoe. Okay, because despite what you think, things are constantly changing. Okay. As we mature, our foot is going through different changes. It's getting flatter potentially, it's getting wider potentially, and therefore maybe even slightly longer. Okay. If you're buying for children, make sure you're getting the shoe that fits them now and not what's going to fit them a year from now. Some people want them to grow into it, right? Um, this one's an important one. A lot of shoes have a very specific shape to it, but they don't accommodate for having a wide foot. And so make sure you look for a shoe that is the width of it is accommodative to the inside and the outside of your foot. Because even if it has a stretchy material, and like I said, it doesn't hurt when you initially put it on, it will most definitely give you issues later on. If you have orthotics, make sure you try on the shoes with those orthotics. Okay, my recommendation is usually to take out the inner lining of the shoe and replace it with your orthotic, whether custom or over the counter, doesn't matter. That's the best way to try it because that's how you're going to wear it. Okay? Try the shoes on and walk around the store for 10 minutes. Okay, I think you'll find that a shoe might go from, oh, this is comfortable to uncomfortable within that 10-minute time. And so I know you people might look at you, but I think it's important to give it the time and really work it and see if it's a good shoe and it's comfortable for you. I recommend shoes to patients all the time. There's a list of shoes that I have. What I tell people is like, I know that these shoes are good shoes. However, which shoe is good for you will depend on you trying it on and seeing how it feels. Okay. Um, the shoe should feel comfortable right away. It shouldn't. As soon as you put it on, if you say, "Oh, I'll break these in, it'll get better," that's not a good idea. Okay. Okay. Getting a good correct size. My rule of thumb is a thumb width longer. Okay, so I'll say go a half size longer. Some people don't like that feeling of their foot kind of slipping in the shoe a bit. What I recommend is that you kick your heel all the way back and then tie your laces down. That usually helps hold it in. Or if you have an orthotic with a nice heel wedge, that usually helps to hold your foot. But giving your toes that room can prevent a lot of forefoot issues like hammer toes, bunions, neuromas, metatarsalgia, things like that. Okay. Um, Measure your foot both sitting and standing. You'll be surprised. Your foot actually changes from when you're sitting to when you're standing. If you sit and you look at your foot, you might say, oh, look, I got an arch. As soon as you stand, things flatten. Okay, there's a reason for that, and I think that's important to be able to assess before you buy a shoe. All right. If you've seen a talk from me before, you've probably heard this shoe test. Okay. Does anyone want to participate? Okay, we're all going to do it. Okay. I want, if you feel comfortable, take off your shoe. Okay. Just one shoe. It might be a little wet. It might be a little dirty. It's okay. You don't have to, but I just want you to try these tests. Okay. And I'm going to come around and look at some of them. Okay. So the first test is taking the shoe and fold it. If you can fold it and it folds right in the middle of the shoe, it's not very supportive. Okay. You want it to only bend at the toes. So do you mind if I take a look at this one? Do you mind if I demonstrate it? Okay. All right. So that folds right in the middle. Okay. This is okay. It's this that we want good rigidity. Okay. All right. I started with bend. Okay. We're going to go backwards. Squeeze is from the heel. Okay. So you want to take two fingers and at the heel, if you can bring your two fingers together, not very supportive. Okay. So if it feels pretty stiff in the back, that means you know you got a good shoe that's controlling your heel, which will ultimately control your foot. Okay? And then the last one is the twist test. So if you can wring it out like a towel, not very supportive. General rule of thumb, if you get 0 or 1 out of these three, don't waste your money. Okay? 2 out of 3 or 3 out of 3, good shoe. All right. We're going to go over some shoes, specific shoes that I recommend for pickleball. And you might find that there's one that you like, you want to go try out. And like I tell everybody, it's important to just go and try it. But this is like fail proof, in my opinion. All right. If I understood your question correctly, you're saying, how often do you need to get a new shoe? I think for the most part, every 6 months is a good rule. Okay. I think depending on how active you are, if if uh, if you're fairly active or really active, 6 months is a good time. Sometimes a little sooner, but I think 6 months is a good amount of time to recheck your shoes. Now, if your shoe started really stable and it's a really good, robust shoe, it might still feel very stable at 6 months. Now, that doesn't necessarily mean that it's still good because there are subtle changes that happen in a shoe that don't really quite match with the shoe test that do alter the way you walk. So, I guess I would say every 6 months and reassess. If you're starting to feel like the shoe was really good for the first 6 months or 9 months and then it's not anymore, likely it's because of these subtle changes in the shoe that are causing an issue. Okay? All right, so we're going to go over a few shoes. I have not tried all of these, but like I haven't tried them on my foot, but I have touched most of them, and I know that they passed the test. Okay, so the A6 Gel Renma or the Gel Resolution. This is a good cushion shoe. It's got good lateral stability, so for those side-to-side movements, it does help to prevent rolling over. Um, this reduces impact on the joints because of that cushioning that it has. Now, I'm just going to give a little caveat here. So I just talked about rigidity. I want a really tough, hard shoe to bend. But I don't necessarily mean that the shoe needs to be hard. Your shoe can be stiff, but still have cushioning and feel soft. Okay? Everyone wants a shoe that feels comfortable on the inside, but we just don't want it to be too floppy. Okay? The New Balance 806. New Balance, everything is a number. It's hard to memorize them. But this one is good for those who have bunions or hammer toes or wide shoes because they have a pretty generous wide toe box. They have good double E width type options. They have good arch support. But you could also, they're good because of the width, so you can accommodate an orthotic in there. Okay? The K-Swiss Express Lite or the Hypercourt Supreme from K-Swiss. These are lighter weight, but still have a pretty good rigid sole to it. There's flexibility because of the lightness, I think, of it, but I think still offers the support that you would need. These shoes here, I mean, I think when just looking at these, if you're looking for a shoe that you feel like you have a lot of heel pain, like plantar fasciitis, maybe Achilles tendonitis, metatarsalgia, that pain in the forefoot, I think that the Hoka Bondi is a really good shoe. Okay, it's what I would consider a maximalist type shoe. So I'm sure you hear about people talking about, oh, this is a minimalist type shoe. I don't know that it's ever been coined a maximalist type shoe, but that's what I'm going to coin it. Okay, it's very, very, very supportive and it's very cushiony. So I think it'll help make your foot feel more comfortable and stable. This thing passes the test. I mean, look at the sole. There's no way you're bending or twisting that thing. Where I think that there might be a downside to this shoe is with the lateral movement. Okay, so I would make sure that you try doing some side-to-side movements with that shoe before you commit to it. All right, let's talk about some orthotics. Okay, so there's custom and there's over-the-counter. Okay, so question I get asked often is, do I need custom? Well, I think my preference is always custom just because it's made for you. It's made with more durable materials, so therefore it lasts longer. Okay. When I make a custom orthotic, I'm putting a prescription into it specifically based on what I'm seeing on your foot. Okay, so not only is it customly molded to your foot, but we're putting things and alterations into the orthotic to help accommodate whatever condition you might have. Does that mean that everybody needs a custom orthotic? No. Okay. And so if you want a sort of gateway drug I would try an over-the-counter orthotic, okay? My favorite brand is Superfeet, okay? It's not for everybody. I realize that some people don't like it. They have so many different kinds. Generally speaking, the green one, a majority of people do well with. So like Superman, but Superfeet. It's more affordable, which is good. You have to change them more often, probably as often as you change your shoe. And because it's not made for your foot, it's made for the mass market. It may not, conform well and give you the ultimate support you need, but it's definitely better than nothing. Bracing, I think that the difference between bracing and taping, I think that they both offer comparable support. You might find that maybe taping is more supportive, depending on how you do it. The only issue I have with taping is you got to do it every time. A brace is pretty easy to throw on, lace up, and put a Velcro on, and you can wash it and reuse it. You put that over your sock and then into your shoe. It seems like it's a lot, but you can fit it in there. And so if you feel like you have instability around the ankle, or maybe peroneal tendonitis, or you're having problems with that side-to-side movement and you feel like you need a brace, I would get a brace first and then take it to go buy a shoe. Okay, that way you can make sure that the shoe that you buy is accommodative to the brace. I think most of them are. You might have to loosen the laces a little bit before you tie them, and this should help to be able to accommodate both. Yeah, so then the difference between the two, I think they're comparable in their support. I just tend to prefer bracing just because of the ease of it. A good one is this one here, the ASO. Okay, it's pretty standard, pretty affordable, and I think it offers really good support. Obviously, there are different braces that are more supportive. They just tend to be more rigid, and so it makes it a little hard to play, in my opinion. But if you're looking for a good brace, that would be a good one. But just to conclude what we talked about, I mean, just being aware of what the sport offers, what kind of movements that you do during the sport, and how they have an impact on your body is really important. And being prepared, just like you prepare for the game and getting, a nice colored short, or preparing against your opposition, knowing your opponent's tactics and whatnot. You got to prepare for your body as well. Okay, be prepared so that you can continue to play and play pain-free. If you feel any pain that's persistent, seek medical attention. And it's always better to come in and for me to say, nothing, don't worry about it, you'll get better, than to come after the fact when you've had a rupture or a fracture and say, I overdid it and I shouldn't have, right? So prioritizing the things that you put on your foot and the things you wear around your ankle will do you justice when it comes to preventing injury. And with that, I thank you for your time.